Hey everyone, I'm Dr. Missy Albrecht with Invincible, and I'm super excited to dive into a little bit of information about organ movement. So I'm going to share this here with you. So this is going to be a brief webinar here to talk about organ movement. The goals are going to be to talk about why the heck do organs need to move? Why does that matter for our health? It's not a common thing for people to think or talk about. And then how we're going to go into how organ movement is lost and how that affects our health. How can organ movement be improved? And then also how you can improve your organ movement on your own at home. So I am a doctor of physical therapy, and this is my story of how I got into the organ work, specifically visceral manipulation. So here on the left, I was just coming out of college, was struggling with what they diagnosed me with was chronic fatigue syndrome. Super just pale, unhealthy, thin, just didn't look very good. But I found an amazing nutritionist. I actually had quite a team at the time, but the nutrition piece was really what got me to start to feel better. I found out I had a gluten intolerance, leaky gut, was also having low back pain, but it was the nutrition piece that really started to, again, move the needle and feeling better. But I entered physical therapy school still with this right sided low back pain. And we had a professor, luckily in school, who did a day introduction to something called visceral manipulation. And so I ended up going to see him as a patient, and he was able to get rid of my lower back pain with working my intestines, which was just like this mind blowing moment of how amazing is the human body and when can I learn to do that. So I essentially spent some time fine tuning becoming a traditional PT and then dove into training and have since learned, in addition to visceral manipulation, neural manipulation, vascular, working the brain, essentially just these deeper structures that oftentimes can get missed. So John Pierre Barral is the Barral Institute is where I've done most of my training through, and he is the man who discovered visceral manipulation. And he talks about an organ in good health has good physiologic motion. And so if you look at this MRI video over here on the left of breathing, this is one of my favorite videos because it just really emphasizes how much movement is required for the lungs and the heart and the liver, the stomach, all of that needs to be able to move to function well. So there's a couple different definitions down here. Mobility is this movement that you're seeing in this video, external forces such as the diaphragm or the heart beating, creating this gliding motion of the organs. And so, actually, if you sit here, you can make a C shape around your diaphragm and check in with your own organ movement. So, as you sit here, take a couple of deep breaths and see, do you move evenly right to left, front to back? How do things feel? Do you feel like you can take a deep breath? So that's a nice way to check in on your own organ mobility. So each organ needs to be able to glide and slide in relationship to the other tissues without any restrictions. And then there's a movement called motility. This is a intrinsic motion that is actually from our embryologic development. And so if we look at the kidneys, for example, they sit below the diaphragm on the back side, right along the spine. And so as you're sitting here, even independent of the motion of the diaphragm, breathing, and heartbeat, they have this rhythm where they rotate out, drop down, and then come back up. It's about 7 cycles per minute, that pattern. And so this is another area of movement that can get lost, but that is required for optimal function of those organs. So each organ has its own independent pattern that it moves through. And so this is a pattern that through trained hands, we can actually feel and retrain, which is awesome. And then I like to mention that organs are held in place by a couple of different systems. We've got a pressure system within the organ, as well as within the surrounding space. We have to have a certain pressure in the space above the diaphragm in relationship to a different pressure below the diaphragm to help everything stay in place where it belongs. And then we have some double layer systems for gliding. A good example is the mesenteric root that attaches, it's a layer of tissue from the small intestines attaching to the front of the lumbar spine. And so that's another area of attachment, keeping those tubes in control where they belong. And then there's also ligaments. So we have various ligaments that attach organs to different areas of the body to help maintain that position. And then another piece of movement with the organs is the organs need to be able to move for the surrounding joints to move well. And so a good example is when you lift, if you try lifting your right shoulder overhead, your liver is really big. It's mostly on the right side, some on the left side, right below the diaphragm here. You can see it on the in this video. But as you lift your arm overhead, it actually needs to be able to rock back as well. So sometimes we will see with patients that maybe they've done all the traditional therapies and all they need is that last little bit of help with their liver to really get that motion that way. And so you can actually, if you'd like to kind of mimic a liver restriction, you can grab your t-shirt in that right diaphragm area and just see what it feels like when you pull down, creating that fake liver restriction, and just see how you feel it all the way up into the arm. We're all connected. And so we have to make sure that these deeper structures are moving well. So how do organs lose movement? This is an amazing diagram that we actually have in our office in a couple different places that Tad Van Wanveer created. I have the link down here, but it just shows an organ system organized. And then on the right side, there is a disorganized organ system and really skeletal, and how the fascial system connecting all of those systems can really add tension throughout the entire body. So essentially a restriction, fixation, or adhesion to another structure, no matter how small, implies functional impairment of the organ. And so that liver restriction that we all created on our t-shirt, that has the ability to then affect the lower back and the pelvis positioning and how we're breathing and how our neck turns. But it also affects how the liver processes hormones, helping with bowel movements and digestion and getting toxins out of our system. So there's so many different layers of it. So when we look at how organs lose movement, there's various ways we can have an impact to the body, concussion, whiplash, a fall to the tailbone. Things like that create trauma, tension in the system, and can affect the organs. There's surgery, so the typical kind of scar tissue, maybe gallbladder removal, appendix removal, tummy tuck, C-section, disease processes, viral infection, inflammation in the gut. So just having an inflamed gut for many, many years can create these adhesions, the stiffness in the organ system. Poor posture, so slouching forward and not getting that good diaphragm movement can then escalate and kind of snowball into poor organ movement and kind of feed into that poor breathing pattern. We can have an emotional stress or trauma that our body is not able to work through. So let's say we have an unbearable grief happen in our life and our brain is just too much to hold on to. our organs can actually store some of that excess emotion. And our hope is to get it out of there because those stored emotions over time can create loss of movement as well. Pregnancy can shift things around. Female body is definitely designed to grow a fetus well and deliver it. But if we have some of this tension beforehand, it can make growing a fetus, delivering a fetus, recovering from that a little bit more challenging on the body. And then nutrition is a huge, huge piece that's outside our scope of practice, but just not eating well, having mold in your body or SIBO or your microbiome is imbalanced. And so we work with a lot of professionals that are awesome at the testing and guidance of that. And then different lifestyle factors like stress management, how much toxins you're coming into contact with, your body care, cleaning products, that kind of thing. So, what you may be feeling, I have this breathing MRI here again for a little example. So, let's say you have really intense anxiety that's just not improving, and you've been bloated and constipated your entire life. So, if we look at this breathing MRI here, you can see maybe the liver's gotten really stiff because you're not excreting waste the way that you're supposed to, so you're reabsorbing some of those toxins. And so that's not going to allow the diaphragm to drop down very well. That liver might be restricting that diaphragm movement, so your breathing patterns start to come up into your neck and your chest. That can feed into that anxiety cycle and make it really challenging. Maybe you're doing all the nutrition stuff, but that tension is still in your system that we need to manually get things moving to help improve bowel movements and anxiety. Reflux is another one that can affect that area too. If you look at the esophagus coming right along that heart in between the lungs, and how any type of irritation up in here can also change the breathing pattern and feed into that anxiety depression. So just an example that you can kind of see with this awesome video. But some of the other things people feel will be hormone imbalances, whether it's PMS, irregular menstrual cycle, really intense menopause symptoms. Sleep can really get disturbed, nervous system overload, so the inability to really just regulate day-to-day stressors. Um, sometimes you do the perfect supplements, medication, talk therapy, but when there's tension in the system, you're not going to get to that optimal feeling. Gastroparesis, so slow digestion, infertility, tinnitus, so ringing in the ears, vertigo, difficulty focusing. This stuff affects the brain, getting blood flow up to the brain, all that stuff. Headaches, and then just pain really anywhere, pelvis, joint, muscle, nerve, kind of like the story that I shared about myself, how tension in the intestines can refer into the back. We oftentimes will think of referred pain as being, the typical left shoulder pain and I'm having a heart attack, which is also a real thing. But we also have these other smaller messages that our body could be pointing to a musculoskeletal issue, but it's coming from an organ. So, what can we do about it? So, visceral manipulation, I like to put this definition up here. Sometimes it sounds like an intense chiropractic adjustment for your organ system or these deeper structures, but it's very gentle, it's very specific. There's a lot of training that goes into our hands of assessing the body as far as what area needs to be worked on first. Maybe you have a liver issue, but we have to work the bladder first. We really listen to the body. And then we're really intentional to be specific and gentle on those tissues so we can listen to what the body is actually telling us needs to be worked on what direction the organ needs to move to actually let go some of those root deeper tensions. Um, I love John Pierre's famous dictum, only the tissues know. So that's what we're trying to look at with our hands. So it expresses the statement expresses that tissues in the body have a deep and innate intelligence. Everything that has happened in our lives, injuries, disease, stressors, etc., are recorded in our tissues. At the core of visceral manipulation is listening to the tissues with our hands. Through manual listening techniques, trained hands of a skilled practitioner feel where the tissues are pulling toward the area of restriction, the areas where the body is not moving, and the areas of greatest impact on the person's well-being from the manual therapy perspective. So it's just cool to hear his words on what he discovered with this work and what we are all trying to share with the world here. And then I just wanted to share this really cool ultrasound here of the, let's see, so this is an ultrasound of the liver stomach area of someone who had their gallbladder removed. This was before I treated them. You can see there's not a ton of movement. There's a little bit of movement. You can see the abdominal skin layers here, and this is the organ system deeper here. And then, here we go. So this is the movement after treatment. There we go. So you can see how much movement is happening below the muscles and even on top of the skin and the muscles. But there's so much more movement. You can see the tissues sliding and gliding along each other. And that's the goal. This was just 30 minutes of treatment. So it's really pretty cool what we can do with this gentle treatment. All right. So another thing that we can do is self-care. So essentially what happened, this was back in 2019. I was a couple years into doing this organ work and having a lot of people message me, what can I be doing? I live in the middle of nowhere. Nobody is near me, provider wise, or I just can't afford to go see someone. What can I do? And so that is where the organ healing guide came from. So it's an online resource with a ton of information for all the major organs of the body. And it's essentially a library, a database of everything that we've given to patients over the years to help support lifestyle, discomfort, digestion, pain, sleep, all of that stuff. So it's an online resource that you have access to, lifetime access to it, always adding new content because we're always learning different ways to help people. But it's a really amazing self-care resource. So going to walk you through it quickly here. So once you purchase the guide, you will have a questionnaire down here that you will fill out. And this is a bunch of different questions that help guide me, not because I can't feel your body. I'm looking more at your history to guide you as far as which organs you should start with. So this really cool interactive diagram here, you can click through and start to work through some of the self-care guidances here. So you want to fill out that questionnaire. And then there's some of the tools that we recommend that are ideal for some of this stuff. I prefer the tune-up fitness tools because they're a little bit softer for some of these vulnerable areas. And then where you can buy some of the essential oils. So we use that quite a bit in the guide too. So there's female and male here. And so if I click on, let's show you the stomach here. So each organ is going to go through a super brief explanation of what the organ does, what may cause that specific organ to lose movement. And then we'll get into the things that specific organ might lead you to be feeling. Just to help you relate to it a little bit more, we'll go through some anatomy stuff, various movement education things as well. So some of this is yoga postures, some of it's sphincter stretching, posture. This is where kind of the meat of the information is from, just videos over the years that we've collected. And then we dive into some essential oil recipes. I I personally, as long as it's a really clean company, I will take the essential oils occasionally internally. But in general, most of these recommendations are topical or diffusing because I really like to leave it up to the doctors, functional medicine, nutritionists who are recommending the internal piece. So that's what these recipes are for. And then we also have an emotion section in here. So, what can we, if there is an emotional trauma or pattern that's stuck in that organ, how can we start to help get those emotions moving? So, some emotions that you can reflect on and see if you relate to. And then I will have people take a screenshot of this image and maybe have it on their computer desktop or their phone desktop to phone screen background image so that they can have that reminder throughout the day when maybe those thought patterns come into play. They can have this positive affirmation to look back on. And then we've got a bunch of FAQs, so frequent questions that we will get from patients based on that organ, and then additional resources from books to other providers that we've worked with in the past. So it's a very comprehensive guide. Um, so if you're interested in purchasing that, if you come to our website products page, you can click on the organ healing guide. There's testimonial in there if you want to check it out, but you can buy it for $99. You can get quite a bit of information to dive into that self-care piece. So the self-care piece never replaces the in-person care. But again, if your location doesn't allow you to get to care or your current budget doesn't allow you to get that personalized care, we can get a little bit more personalized care through that questionnaire and give you this amazing database to pick and choose. You can't do it all at once because that's not how we create lasting habits, but really just starting to support your organ system. It's pretty amazing the little things that we don't tend to do just in our culture right now that can really support that healing. So hopefully this information was helpful and you have a better idea of why your organs need to move, why it's important. And we're always here for you if you have any questions, but happy organ moving.